Hello! It's been quite some time since I've made a video last, and I'm been in the hospital for a few days, and I'm kind of needing to do something to keep myself busy, and I figured this was the perfect way to do it, was making a new video. So I was trying to look around on the internet and Tumblr and through other YouTube channels to find a good CF hospital tag, and I really had a hard time finding one, so I just kind of wrote one. It's just got a few simple questions that I'm going to answer for you, and hopefully I can inspire some others out there to do it as well, maybe. Okay, so I'm going to start off with a little pre introduction. If you don't know, I have cystic fibrosis. It's a genetic disorder, which basically just means that my lungs are really screwed up, as well as a few other things. I will include a link down below that has some more information on it, just because I'm not the greatest at explaining it, and I can get you some people, some links that will do a way better job than I can. Okie doke. So the first question that I've got is, why am I here in the hospital? Well, cystic fibrosis included, I just get really sick often, and that's kind of the reason I get sick quite a bit more often than the average person. That is the reason. But I get pneumonia and Pseudomonas. I have it chronically. It just flares up and gets worse. I'm on a schedule that it's actually about every 3 months. So usually I'm on regular IV antibiotics, but this time the IV antibiotics the doctor put me on had a really bad effect. They made my joints really, really stiff, and they made my muscles hurt and ache, and I couldn't walk or move at all. And that was quite alarming to the doctor. So he took me off of those medications, and in order to find a good regimen that worked well, he thought this would be the best option until we found a good solution. So, yay for getting better. Question number 2. How long will I be in the hospital? Well, this is about my 4th to 5th day. It depends if you include the admitting day. 5 would be yes, 4 would be no. And I have no clue when I will be allowed to leave. It's kind of like prison in here. But no, right now I'm just kind of focused on getting better, and I'm trying not to be too concerned with what's going on in the outside world or when I'm going to be going home. I'm optimistically hoping by the end of this week, but the doctor really hasn't said anything, so that may not happen. Question number 3. The hardest part of being in the hospital. This is kind of a tough question because it seems really easy to say things like the lack of sleep, because you're always being woken up in the middle of the night for different reasons, or to say the shots and stuff, like to get your blood drawn. But the hardest part is, I guess, the hardest part is that life goes on at home without you. That kind of sucks. Like, to be like pessimistic Polly here for a second, like to see everybody else on like Facebook, going out and having a great time, and I love that people have a great time. Like that, I would never want someone to take their time from their day to stop and be miserable just because I am slightly less happy. But it just kind of like, it's become so normal for me to see that it's so easy for other people to just get along without you. But to really stop and see how smooth those transitions are from you being in somebody's life one day to being picked up and put somewhere else. And that's just kind of like, it's a little deeper than I meant for that question to go. But yeah, it just kind of, just kind of sucks sometimes. But I mean, it's a good thing for them, I guess. Okay, next question. The fourth question is, because you can't have one negative without a positive, the best part. And I'm going to compare in-hospital care to at-home care. Doing the same IV antibiotics I'm doing in here at home is just a lot more stressful. To put IV antibiotics on top of going to work, or going to class in some cases, and to fit in like the pressures of having people text you saying, "Hey, do you want to go out today?" and trying to explain to them that I have a strict schedule for these medications and I can't just switch them up, or I can't just skip them. That can be very hard. And there's a lot of temptation to not do what you're supposed to. And when I was quite a bit younger, that temptation got to me a lot more than it has now that I'm older. So the good part about being in the hospital is that you don't have pretty much any of that. I can get up and walk downstairs to the cafeteria. That's about as far as I can go, but there's no excuse for me to not lay in bed and take a nap if I'm tired, or to not focus on getting better. And that's the whole point of for me to be in the hospital. That's why I'm still here. I would have gone home, trust me, if I could. And I felt that it was the best decision. That's where I would be. Question 5. My hospital must-haves. I'm going to say my number 1 must-have, I'm only going to list 3 because I pack a whole suitcase when I go to the hospital. So I'm just going for my top 3. Number 1 is my laptop and the charging cable, so it's like 1.5 things. I don't think I could manage my life without it being in here. It would be so hard to try to maintain the same level of social interaction that I would have anyway. And I mean, come on, I've got like YouTube and all that. It's so easy to keep myself busy. But yeah, if I didn't have my laptop, I'd go nuts. The second thing is a comfy pillow. Now, they give you pillows in the hospital, but my pillow is way better. And it's like got me in it. So it's like a little piece of home. My third thing, following the pillow, has to be a blanket. And this is actually that was a good place to pick the blanket up from. My superhero Avengers Marvel blanket. I've had it for quite a few years now. It went with me to college, and it's coming with me to the hospital. It's super toasty and warm, and if I could, I would never leave the house without it, because it's so comfortable. And that's the whole point, is being comfortable. You can't do anything if you're not comfortable. You can, but it's not very easy. Okie dokie. 6. What do I do all day? That's a great question, because the answer is summed up very quickly as nothing. Okay, that's not quite true. Quick run over of the day plan, and this is pretty much every day. Some timing may vary. They wake me up around 8 a.m. Correction. They wake me up and expect me to stay awake at 8 a.m. And that's when the nurse usually comes in and gives me my morning medications. And then it won't be too long, if she didn't get to me first, that the respiratory people will be in to do my breathing treatments and my vest. After that, I'm not a breakfast eater. I wait till about 10 or 11. Correction, usually I try to fall back asleep. Sometimes I do, sometimes I don't. And then around 10 a.m., the physical therapy people will come in. I have a really cool physical therapist, this week. She graduated from the same high school that I did. It's really cool. So we've been talking about old teachers and all of that. It makes it a lot more fun. Physical therapy usually consists of getting chest percussions, which is where they do this, to try and break all the mucus off the edges of my lungs so I can cough it out. And then I go on a short walk, 6 minutes usually, which is 2.5 laps around the nurse's station. No, I think we did more than 2.5 today, but anyway. After that, I usually ask my nurse if I can get a bowl, some milk, and a spoon so I can have my Fruity Pebbles. I bring my own cereal because they don't provide us with Fruity Pebbles here, which is like really disappointing. But yeah, then I'll eat my cereal. I'll probably take another nap. Facebook status checking, all of that stuff in between all of this because but then at 5 o'clock I have a med that's due, so I do that. And then after that, after about 5 o'clock, I'm pretty much up for the day. I don't usually go back to sleep after that. I'll order some food, and then I get on Facebook pretty much for the rest of the night. Facebook, Tumblr, YouTube, all of that. Sorry, I'm shaking the bed. And then they come in. Oh, crap, I missed a PFT. I'm sorry. Or PFT. A respiratory breathing treatment session. There's one of those around 1. Then there's another one around 7 or 8. And then I try to order food again later because they end part of the menu at 9. So I'll try to get that in before they stop serving dinner. And then after I eat, I basically just get ready for bed. That's a pretty average day for me. Sometimes I try to do stuff like sketch in my little sketchbook. I try to do something to make myself feel productive, which is like really hard because no matter how much I do, I've still slept most of the day. I'm not going to feel productive at all. But that's pretty much a day. That's the whole day. It's mostly sleeping. Question 7. What do I eat? Okay, you've seen my Fruity Pebbles, yes, but these are my pretzels. Well, these were my pretzels. There's only a few left. I also have my own stash of Cherry Coke because the University of Michigan has taken all regular soda out of their facilities, meaning I can't have Coke, Cherry Coke. It's all Coke Zero and Diet Coke, which is disgusting. It sucks. So I brought my own. Then I have these lovely little things. They're Scandi Shakes. I call them fat shakes. For a good reason, mind you. There's, in this little packet, okay, no, that's with the milk. If I put this packet in an 8-ounce glass of milk, it's 580 calories. So, which I have to, it's weight gaining shake. I don't gain weight ever or at all, and please don't say that's cool because it actually really sucks. It's a lot of work. Just to try and gain a couple pounds. I guarantee you, for every pound you try to lose, I am trying to gain that pound. Okay? We're even, I promise. But yeah, these are just vanilla flavored ones. They're actually pretty good. So aside from that, I have this. I have 2 menus. Because I am on a very strict gain weight diet, this is a high calorie, high fat menu. It has some things that regular patients can't order, like chicken nuggets and tater tots, which is really sad because I don't eat those things anyway. I'm sorry for all of you people who want the chicken nuggets and the tater tots, but I can have them and that I do not eat them. I apologize. But, yeah, and it also has a list of ways to make regular things that anybody can order to give them more calories and make them more fattening. So, than the regular menu. It's actually a pretty good menu. Like I mean, that's a lot of choices. We've got lots of decisions. And my favorite thing that I order right now is oh, well, we just had a visit from the nurse, and speaking of food, I just got mine. Excuse my messy room, but look at my little food tray. I cannot position this properly. Okay, we'll just do it this way. Why not? Okay. My favorite thing to eat at the moment doesn't look very good from far away. It probably doesn't look very good to anybody who can eat regular food anyway, but it is Asian beef stir fry. And I ask for lots of soy sauce with mine because that's the way I like it. And my absolute favorite thing, which is really weird because I don't even come anywhere near eating something like this at home, but it's orange Jell-O. I can't get it open. Yeah, look at it go. They got really nice, and they gave me 2 this time. It's the little things that make your day. Having 2 orange Jell-Os. But yeah, that's basically what I order to eat every time. Yeah. Oh, juice-wise, I ordered these little juices. They're little juice box cranberry juices. They're pretty delicious, actually. Like, I was expecting them to have some, like, cran apple, like, combination juice, but it's just, like, real cranberry juice in a little box. I was happy. Anyway, the next question, we're on question 8. Hospital gown or street clothes? Okay. This is kind of like the comfort factor. If you've ever worn a hospital gown, they suck. Like, if you don't have any options, like, obviously you don't have a choice, but like I said, I bring a whole suitcase with me, and I pretty much pack up every single pair of pajamas I own. But yeah, I find hospital gowns really uncomfortable because if you're going to get up and do anything, you have to wear 2. You kind of really do. Front and back. But I'm in a position where I'm able to dress myself, and I wear my own clothes. Sometimes I wear like real pajamas, and then this is actually like a really comfy dress that I have on. It's just like a little summer cotton dress. It's really comfortable and soft, so it's really nice to sleep in. But yeah, so that's what I wear. I know some people will bring clothes to wear like every day, like whole outfits, and I'm just kind of like, oh, whoa. It's kind of like wearing high heels to the airport. We already know you're going somewhere. It's nothing like that. But because it's all about being comfortable. And, like, I can't deny somebody if they're more comfortable in a pair of jeans. Like, I wouldn't want to sit here all day in something that I'm not comfortable in because it's not worth it. It sucks. Like, sitting here all day anyway isn't a lot of fun, so to sit here in uncomfortable clothing would be worse. A lot worse. Definitely a lot worse. So, comfy clothes for the win. No matter what your comfy clothes are, mine are pajamas. Last question. How do I stay sane? I suppose there's the question if I ever have been sane. Some people would argue about that. No, I try to keep myself busy. I operate a blog, like 3, so I'm always trying to keep something going. I talk to my friends pretty much every day. Actually, I talk to them pretty much every minute of every day. And yeah, it would be worse for me if I didn't have something to motivate me to keep me moving forward. So I always keep looking forward. I start classes at the University of Michigan in Flint this fall. So I look forward, I keep checking the class schedules to make sure everything's right. And then I keep checking my emails to make sure I'm not missing anything at work or that they don't need anything. And that's kind of silly because they really understand that I'm here, but I guess I just am paranoid. I eat constantly. I'm always snacking on those pretzels. That was a full bag yesterday, and now it's not. So we just keep moving forward. Just keep doing things. And when I'm not doing something, I'm sleeping. Because that actually really helps a lot. It makes you feel better. I hope. Actually, when you take a nap and you kind of feel worse when you wake up, every time. And I'm always convinced that I'm going to go back to sleep and wake up and feel so much better. Does not happen. Why is that? Anyway, I've dragged this on a little bit farther than I intended to. It's a wee bit longer than I thought it would be, but that's it. That's my hospital tag. 9 simple questions. I'll put the questions down below if anybody wants to, do their own, make your own questions, do what you want, say what you want, all of that free-spirited stuff. But my dinner just got here, so I'm going to go eat it. And I hope you all have a fantastic week. And just, even though being in the hospital sucks, like my ending note, it really is the best place for me to be at this point. So always end on a happy note. I'm right where I should be, getting as healthy as possible so I can keep going. So, bye. I'll try to make a video in less than 6 months.